Dr. Patterson here, and I'm going to talk about the colon in this video. And my patients who've known me for like 41 years or more know that I've always stated that all disease, no matter what it is, except for trauma, all disease, especially all of your chronic illnesses, have a basis and an origin as to some sort of dysfunction in the colon. And so we're going to talk about this because this is a model, and you used to be putting up a model of the perfect anatomical version of what the colon looks like, but actually this is from a surgeon's view. A surgeon put this together, and what he saw, here you have an inflamed appendix, what appendicitis looks like. Here we have, right here you have skip lesions. You would see this in a patient with Crohn's disease. This patient would exhibit some sort of what we call the skip lesions. They basically bleed and then they don't bleed, and they have off and on bleeding episodes. Okay, here you have diverticuli. These little dots here, that's really stool embedded into the pouches right there. Very common. It's hardly a patient that we see today who don't exhibit some form of diverticulosis. And the funny thing about it, when we talk about foods, one of the best foods for your colon, which will help to rebuild a leaky gut or any type of problem with the lining of the colon, is okra. And here, this patient will be taken off okra because of a seed got into this opening here, this little area where these little holes are. A seed got in it, it would set up an inflammatory condition requiring some sort of medical intervention. They would have a lot of pain. There's so many problems associated with a seed getting embedded. So one of the things that are taken off of is foods that contain seeds, and most of the foods are the foods that they need. You know, here what you see in yellow, this is a bacterial infection. So this patient would present with diarrhea. We would actually, if this patient was undergoing colon therapy, so we would have to work with a patient that this happens to who is familiar with it. They would come in, they know that they need to be cleaned out. You say, well, I'm going a lot. You're getting out bacteria laced with the liquid in the colon. You're not getting stools. So you can actually become constipated following a bout of diarrhea. And it may last, a few hours to a day or maybe even 3 days. Okay, but you'd be surprised how much waste matter, fecal material that's left in this colon as a result of this infection. So you're getting out infected waste matter, bacterial infection. That's what's coming out, but the bacteria that's embedded in the stool is still in here. So how do we work with that? They would need a cold water colonic. So that cold water helps to subdue and kill some of that bacteria that's there. In the colonic, the water goes around. Not the patients are confusing the probe that's being used with the camera on it in colonoscopy with colonic irrigation. With colonic irrigation, there's a speculum, like with an animal speculum, goes into the rectum, and the water goes around. So we send cold water around, get to that phase to help get rid of some of the effects of the bacteria. And usually this clears up with a colonic. It's unlikely that this doesn't clear up. Here we see a colon tumor. Colon cancer is on the rise. It's on the rise in all races of people. So don't focus basically just on the African-American community, and I'm in that community. So I'm not focused basically on the African-American community. It's in everybody. The numbers are just different as a result of the population. The difference in populations, the numbers will be different. But it's in everybody who has some sort of aversion to good foods, or in terms of genetics, maybe about 1%. 1% will have a genetic predisposition to colon cancer. The other 99% will have some sort of epigenetic contribution being made by their environment. And 70% of that is basically the food that they should be eating that they're not getting. Here we see polyps. Usually when we go with the colonic, we go in to inspect the colon with a digital rectal examination. You can feel polyps within the first few inches if they're present, because they're usually lower down in the sigmoid colon. I think you can see this here. They're usually lower down in the sigmoid colon. Okay, so basically, when we're doing that preparing the patient for a colonic colon irrigation lavage, then we can feel for it. So that's what we're testing. We're not only just preparing for the interest of specking, but we're actually checking to see if there's some sort of pathology, that we may have to refer that patient out for further examination. One of the things that we talk about food. Food is so important, okay, and so we can see where the diet has a major contributing factor to the type of health that one may have, not just the colon, but we know that there's some sort of relationship between food and the processing, how the body processes the food, metabolize the food, and the production of its waste and the elimination of its waste. And so if you don't properly eliminate that waste matter, then whatever the food contains, however it was processed, will either have some sort of deleterious effect on the lining of the walls of the colon and the amount of good bacteria versus bad bacteria. Now, we talk about food, okay, we want to know about diet. I want you to take a look at this book right here. It's called Nutrition and Physical Degeneration. This is a book that most of you, I think all chiropractors have this book. It might be out of date right now or out of print. I don't know. You should be able to find it. But Winston A. Price was okay, I'm going to take this out. Winston A. Price was a dentist, okay, and he was not getting the results he felt that he should get based on his dental education, okay. So he wasn't getting the type of response to what he was doing, and the patients were requiring more dental care, and yet they were not getting better. And he had the money to do it, but he decided to take a trip and visit every corner of the world. And what he found was that people who participated in traditional cultural consumption of food, and that means food on their land, no matter what the food type was, basically did not have Western diseases. And that's very important to understand what we're talking about. Western diseases is really European diseases. And people who participate, no matter what your race is, in the consumption of this European type of way of eating will have European diseases, Western diseases, that's what they call it. And so he narrowed it down to the dental care and dental problems. And what he found was, no matter how what we call primitive people were, or backwards as it relates to, when they say backwards, they're relating it to how modern Western society is compared to this. The people who just basically lived off the land, they lived off their environment, they had the foods that was in their environment, had some of the prettiest teeth. They had the best of health in terms of there's no cardiovascular disease. You went to the Inuit in Alaska, and they basically eat whale blubber, seal meat, no cardiovascular disease, because you know seals have the best oils for omega-3s. So high in omega-3, very low to nil in omega-6, no inflammation. And these people had no health problems, no cardiovascular disease. No matter where he went, the people had very good health, and they ate the food that was indigenous to the land that they lived on. Let's see, and the minute that Western society started to infiltrate that area with Western foods, that's when they started having the different diseases. Okay, so this is a problem. The other thing that he found, and he says in the book, he will tell you in his book. So you might not want to read this, or just read the excerpts or something on it. Okay, but it's very good reading as we talk about nutrition. He did not find anywhere in the world in his travels where people were vegetarian, fruitarian, or vegan. He didn't find that. That didn't exist anywhere in the world. So basically, it's not to say that you should not participate, because I think that what's happening right now, the reason why in the African American community so many people, it's the fastest growing change in terms of diet toward veganism, vegetarianism. What's happening is that these people who are doing this have become fed up with the effects of Western medicine and the effects of the Western diet. And since this experiment of the last 400 years of us eating non-nutritious really subpar foods, having to have all kinds of seasonings to make this food palatable and consumable, yet is very destructive in this day and age. Not so much back when our foreparents raised their own meats. Uh, they're changing the experiment, okay, and so they're getting good results. The body has got to adapt. The body did not adapt to processed foods, ultra processed foods, contaminated meat. It's not to say that, so this is the reason why we're getting rid of meats from the diet, getting rid of processed foods from the diet, fasting more, getting more involved in drainage, understanding the drainage is an important part of ridding the body of disease. And so, like I say, in this environment, you're only doing or getting the results, which seem to be 100% in the people who start or embark on it, if they are of the nervous systems designed for that individual, where they can require a vegan, vegetarian, fruitarian style diet. The ones who fail, basically the nervous system, they weren't tested now, but I know from experience that they may be more of the parasympathetic type dominant person, and they may have to have a mix of vegetables and meats. And just like what Dr. Winston Price said, he never found a vegan or vegetarian culture anywhere in the world. So this is something that's new, but it's something that may be needed. And I know in our community, it's definitely needed, whether you stay with it or not. So it could be looked at as, I look at it as more of a therapeutic measure. See, so you need other things, because there are deficiencies that are found in vegetarians, nutrition deficiencies, and nutrition deficiencies certainly with vegans, based on the definition of being a vegan if you don't follow it properly. So that was one book. And then the other book, they gave a lot of good information on colon therapy. Okay, this was a chiropractor back in the early 1900s. So this is not new. This is something that's old. Okay, Dr. Bernard Jensen, who I follow, and we like Dr. Jensen. And in his books, he had dietary measures to help patients reestablish. So the problem with this diet requiring major drainage through colon care enemas, colon therapy. Colon therapists have saved a lot of lives today. They don't get credit for it, but they've saved a lot of lives. And chiropractors who have colon therapy as part of their adjunctive care with the chiropractic care that we do and nutritional care that we administer to patients have saved a lot of lives, where ultimately these patients would have gone by the wayside and succumbed to many of the ills that they presented with, that was treated oftentimes with drugs and surgery. See, so the other book is the book I prepared for my patients back, this was about 2012 or so. And so our patient needs something really simple to read, something to give them a little history of colon care, the reason why they need to have it. We also put information as far as the salad is concerned. Always, like I say, in order to be in the public, you have to have tough skin. We get people who come into a little bit of knowledge. When I went to school, there was no internet, there were no computers. Okay, we had books. Today, people don't have books, they have tablets and computers, and the knowledge is limited, but the attitudes of people are such that they feel that they have, it's the second coming, being a vegan. And so what I say to that is, what many of you have done is like a person who goes out and work, becomes intimate, exercises, and then decides, I'm going to go to church tomorrow. They don't take a shower, and they just put on some clean clothes. So you're putting on clean clothes onto a dirty body. This is what a lot of people, how people start. You start off with putting something good and new on top of dirt. And so we educate our patients to make sure that the first thing they must do before they fast, before there's any change in diet, is evacuate the colon. You have a lot of waste that's present there. Most of our patients, especially those who consume meats, you can see undigested meat coming through the during the process of colon irrigation, and you ask them, oh, I see you had such and such because you have teeth marks in the meat that didn't come through. Oh, I had that last week. We talking about 7 to 8 days ago they had it. So it was still sitting there. Had they not had this procedure, no telling what would have happened in terms of them developing or putting themselves in position to develop one of these or any combination of these disorders that we see, the pathologies in the colon. So the colon basically is the center of all of your detoxification processes. It will culminate into your colon. So you want to make sure that you keep your colon clean. I emphatically disagree with starting a fasting procedure, a water fast, without preparation for the fast 5 to 7 days prior to the fast, which involves colon care. You started with a colonic first, you prepare for it for 5 to 7 days, and you started with another colonic, and then you start the water fast. You have no idea how many patients have gotten sick as a result of not doing this process. And so the sickness that they incur is just basically the fact that the body is not receiving any nutrition. They've moved over to a different type of metabolism, namely fat metabolism or lipid metabolism, where they're developing, utilizing ketones that are made by the liver with the consumption or the breakdown of fat. So when you go through this process, there's waste matter that normally would be dealt with as in terms of using food as an analgesic. So you're used to, and the best way to give you an example of this is to look at a person who eats lunch regularly every day, 12 o'clock, 12:15, no later, and all of a sudden they miss their lunch, and now it's like 3:15. They develop a headache. Where does the headache come from? They feel it in the head. It's not coming from the head. It's a gastric headache. It's coming from the toxins and waste matter that was not neutralized by the process of digesting food, which the food act as an analgesic. That toxin is there still when you eat at 12 o'clock. The toxins in the colon are still present, okay? So that tells me too that they also have, this is the first sign that they have, we don't have to say leaky gut, but they have some sort of dysfunction in the gut where the toxins are leaking into the bloodstream, and now they feel it in the head. So if you took that same patient, instead of giving them some sort of analgesic for the headache, and more than likely it'll dull it, but they would still feel it, but you gave them an enema, or they had a bowel movement, or they took a colonic at that moment, the headache would instantly go away. This is what happens. So anytime you change your diet, going from ultra processed foods, going from a heavy meat diet, processed foods, Western type diet, the standard American diet, anytime you change that, it's best not to go cold turkey unless you had some sort of major emotional event that would prevent you from wanting to touch any of that food. And you're going to have symptoms the first 3 to 5 days, but you'll get through it because this fortitude that you have because of something that you experienced. Unless you go through something like that, don't do it. Okay, and even that person would have to eventually go through the process of colon irrigation. Now, the question comes up about coffee enemas. The coffee enema is, you don't have to have cancer. A lot of our patients, cancer or oncology patients, take coffee enemas, and they do very, very well with that because you evacuate the waste matter, and the coffee stimulates the sacroparasympathetic nervous system. This is down by the let's say the tailbone, that area that's the tailbone and just up a little bit is part of the nervous system that will stimulate reflexly the gallbladder and liver to secrete bile. And this secretion of bile is binding. It will bind up a lot of toxins, and then you poop it out. And to accelerate the removal of it, you take the enema. the coffee enema, and that's what it does here. And so here's where a lot of your manipulative procedures actually enhance this removal. So chiropractors and naturopaths are very skilled at manipulating the sacral area of the spine, and this will actually help provide that nervous stimulation to help the gallbladder, help the liver to secrete more bile, to put this into the intestines and deliver it in such a way that it's binding. It'll bind up. It's just like taking a magnet and put it into an area where there's a lot of tacks. They would be drawn right to it, and then you just get rid of that through the elimination through the lower colon. So this is very important, and we have seen where history shows that even certain manias, certain emotional disorders were treated by early medical doctors back in the early late 1800s and early 1900s through colon irrigation. You know, you had certain type of say a person was had some sort of hysteria. They were treated with colon irrigation. A person who was bipolar, treated with colon irrigation. You understand what's a person who has depression and anxiety, treated with colon irrigation, because you have centers down there for your serotonin and tryptophan and what have you. And so basically removing that waste matter will allow this process to take place and will resolve the issue of anxiety and depression. See, so it's very important. We have always instituted this with patients who need it. It's done on a personal level, and so we have personalized care. We don't believe in one diet. There's nothing that's going to be the main type of care. It's not a panacea for any disease. One treatment, one supplement, one whether it be a herb or vitamin or mineral. No one of anything is going to cure a patient or a person. Okay, you need multiple forms of care. This is the way we do it. This is the way we've had our success. And anytime you change your diet, and some patients, they do the best that they can. We're not in the business of trying to shame a person. We have patients who are going out of town for the intent purposes to consume large volumes of food. It's social. That's the culture. And these patients have an understanding. They will come in for colon irrigation prior to leaving for this event, and they make sure that they come in within a few days for another colon irrigation to remove the contents of what they consume. And so this way, I can't really comment or give an opinion as to the practice, but for certain it works because this patient do not build up the waste matter or volume of waste matter that would be detrimental to their health. So this is the reason why I don't talk about that. I understand, but at least they don't build up, and so the waste matter to the point where it becomes a disease process. And like we've always stated, there are like 4 different stages of disease, and patients who go through those 4 stages, basically the first 2, they are able to do that themselves. Okay, they can take care, and this is where the nutrition comes in alone. And many are relying on the fact that the water content is so much greater, the fiber content is so much greater from fruit and vegetable consumption. They notice that there are changes with their bowel habits. They start to go. They think that's enough. It's not enough, but it is definitely an improvement. When you get to the last 2 stages, the pathophysiologic, and you get to the pathological phase, you need intervention. It may be surgical intervention, medical intervention, drug intervention. See, but either way, you cannot do that through nutrition alone. This is where many people who are becoming aware of the effects and the benefits of nutrition fail, because if you don't have the examination, if you're not taking the proper testing measures, some of it may be imaging. Okay, I don't think you need that, but some you never know. Okay, if you have polyps, you definitely need strong measures in terms of testing, colonoscopy. You may need some testing. You all need testing. Okay, the patients who do it for the first 2 phases of their physiologic phase, you can do it, you know, just by diet alone. You still should have at some point have your labs done, at least have an examination at some point in time by a qualified physician. You need to have a team of healthcare practitioners working with your body, where you can call on them, you can get in to see them, and you can also measure your progress. Don't just measure by how good you feel. That's often a very good measurement or standard, but you need to have some baseline where you start, where you're progressing, and where you are presently. So you do it like that. So basically, colon care, number 1, you have to have that done. It's a mindset for most patients. It's amazing how I always say how a lot of our patients have no aversion to consuming chitlins, but you have an aversion to getting them out through colon therapy, the waste matter from that. I have yet to understand it after 41 years of practice. See, so basically, give that some thought. Get the books if they're still available. Ours are certainly available. You can call us to get the book. That's not a problem there. But you need to increase your knowledge, and especially patients who if you have a history of colon cancer in your family or colon problems in your family, you need to get tested. You need to increase your knowledge so you can understand what the doctors are talking about. You can ask civilized questions, okay, that's pertinent to your condition. So there's nothing wrong with getting knowledge, okay, and being able to put it all together. But basically, make sure that you evacuate that colon before you fast, before you change your diet or embark on a new diet, and during the process. That's very important. Okay, best in health.